Hello everyone. My topic was all about coagulation factor assays. Introduction. Factor assays may be part of the testing process to determine the cause of an unexpected prolonged PT or APTT. This test is performed after mixing studies have been performed and a deficiency of one or more coagulation factors is suspected. Factor assays are able to identify specific factor deficiencies or inhibitor. Fibrinogen assay, a clot-based method of close modification of the thrombin clotting time. The principle is the assay measures the ability of fibrinogen to form fibrin clot after being exposed to a high concentration of purified thrombin. Plasma samples are pre-diluted with minimized assay interference from substances like heparin and fibrinogen degradation products. As you can see dito sa illustration, the patient's platelet-poor plasma is diluted 1:10 with orange buffer, and this diluted specimen adds reagent bovine thrombin at 50 to 100 NIH units per ml and converting fibrinogen to fibrin. Fibrinogen assay procedure. Class fibrinogen assay thrombin reagent is commercially manufactured lyophilized bovine thrombin reagent, which is Hemosil QFA 100 NIH units per ml or IL warfarin. So, close fibrinogen assay calibration curve. The instrument coagulometer prepares 1:5, 1:10, 1:15, 1:20, and 1:40 dilutions using reconstituted fibrinogen calibration plasma. The aliquot of each dilution, for instance, 200 ml is transferred to reaction cuvettes, warmed to 37 degrees Celsius, tested by adding 100 ml of thrombin reagent. Time from addition of thrombin to clot formation is recorded, and the values in seconds are graphed against computed fibrinogen concentration. So dito sa graph, this graph illustrates a calibration curve of fibrinogen concentration plotted against the clot times obtained from the fibrinogen assay using log-log axis. So in closed fibrinogen assay test protocol, clotting time of the patient PPP dilution is short, indicating fibrinogen level greater than 480 mg per dl. If the clotting time is prolonged, indicating less than 200 mg per dl of fibrinogen, the instrument employs a low concentration curve. For fibrinogen assay quality control, normal control results should fall within the laboratory's reference interval. Abnormal control results should be near or less than 100 mg per dl. If either control result falls outside the control limits, the reagents control and equipment are checked. The problem is corrected and the control is retested. The actions taken to correct out-of-limit tests are recorded. Specimen errors that affect the PTT likewise affect the fibrinogen assays and all factor assays. So in this table, it is the factors that interfere with the validity of clot-based test results. Specimen variation, blood collection volume less than specified minimum. The solution is PT and PTT falsely prolonged. which is recollect specimen. Hematocrit more than equal 55%. The solution is adjust anticoagulant volume using formula or nomogram and recollect specimen using new anticoagulant volume. In specimen plot, all results are affected unpredictably, so recollect specimen. Visible hemolysis solution PT and PTT falsely shortened and recollect specimen. Icterus or lipemia solution is measure PT and PTT using a mechanical coagulometer. UFH therapy. The solution use reagent known to be insensitive to UFH or one that includes a UFH neutralizer such as polybrine. For lupus anticoagulant, the solution is PT and PTT results invalid. Use alternative methods, for instance, chromogenic assays. For incorrect calibration, incorrect dilution of reagents, correct analytical error and repeat assays. So for fibrinogen assay results and clinical utility, the reference interval for fibrinogen concentration is 220 to 498 mg per dl. For hypofibrinogenemia, a fibrinogen level of less than 220 mg per dl may be congenital or may be associated with DIC or severe liver diseases. Early or moderate liver disease, pregnancy, and chronic inflammation may raise the fibrinogen level to greater than 498 mg per dl. For congenital afibrinogenemia is reflected in prolonged clotting times and is associated with variable anatomic hemorrhage. For fibrinogen assay limitations, UFH level greater than 0.6 units per ml and FDP levels greater than 100 mg per ml prolong the clotting time and give falsely lowered fibrinogen results. For thrombin reagent should be pure and has not degenerated. And exposure to sunlight or oxidation results in rapid thrombin breakdown.